So remember, if you're going to wrap this ankle, that you want to actually do a wrapping that will start out here by the toes, and then your ace bandage, you cover 1/2 the width of the ace bandage with each wrap. Okay? So you'll lay it on, and then wrap and wrap and wrap, and just continue that compression upward. Okay? Does that make sense?
Yeah, I already wrapped something right around the ankle area.
Yes. Now, yeah. Now, when we used to do a lot of the physical therapy, remember we talked about tobacco and how tobacco poultices can draw out that swelling? Works very, very well, and we'll pull the black and blue quickly out of that. The reason we want to get the black and blue out, especially if we've had some type of trauma to the muscle, and again when we're looking at bleeds in the muscle or inside the thoracic cavity, our biggest problem there is once the blood is outside of the blood vessels, that pooled blood will actually, over time, harden or calcify. Okay, if you have ridden mountain bikes a lot, or if you've had somebody who's had a lot of trauma to their thighs, you'll see when the handlebars continue to hit the thigh, they'll actually hit the bone hard enough that it will cause a bleeding upward, and then that will create what looks like almost a cauliflower appearance, and it's called myositis ossificans. Myo refers to the muscle, situs is a condition of inflammation, and it's ossified or becomes bony-like. And what happens is that blood actually starts to calcify. Have you ever had, you're working doing your house cleaning, and for some reason the vacuum hit you hard, or you hit the corner of the bedpost and it left that knot in your leg, and years later you can still feel that little lump in there? That's a calcified pool of blood. Okay? So what we want to do again is encourage the lymphatic drainage with the trauma. So when we see someone who's had an elbow fracture, we want to be working above and in the forearm to bring that blood outward so we don't get the pooling of blood in the muscles. Okay? So we don't have that stagnation or a remnant of that blood. I had a lady who, she was a nurse, and she was at the top of a friend's stairs. She was visiting some friends. They having a church group party or a social, and she went to step and just was talking to someone and missed the step and started to slide down the steps. Well, when she hit on the side of her leg, and it hit hard enough that she had this big bleed in there that started to ossify or calcify after a few weeks. So in her case, what we had to do is find the direction of the muscle fibers, and then, just like pickup sticks, remember the game pickup sticks when you drop them? If you roll those pickup sticks together, they actually start to line back up. And in this case, what you want to do is actually rock that back and forth to help those fibers to be able to line up again, or to break down then this calcification so it doesn't stay hard in there. Okay?